It used to be that many communities would say to a veteran who was struggling with mental illness or substance abuse, you know what, we've got a 8-week program for you we want you to go through. If you can get your substance abuse under control, well then maybe there's a place to live at the end of it. What we've learned is that actually that's totally backwards. How can a veteran who struggled with this for 30 years, how can we expect them to solve the problems of mental illness or substance abuse unless they have a stable place to live? When you're living on the streets, we know that it's just much harder to do that. What we also know is that it's much more expensive for communities to leave people on the streets, because guess what? When they're sleeping on the streets, where do they get their medical care? In emergency rooms. They often spend time in jails or in psychiatric facilities or other things that are much more expensive than an apartment where they could live. And so that's an example of the kind of evidence-based practice that communities have taken on that has really helped to move the needle on homelessness. I ask every one of your members to join us in this crusade to end veterans' homelessness. Step up with us and reach out to HUD, and we can help connect you to the key steps that I've talked about that can help you end veterans' homelessness in your community.